Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Wonka. Here are some of the highlights this hour. Today, PTF gives daily briefing, says measures by government to curb virus spread not punitive. On our theme, we'll look at dispelling the myths around COVID-19 and how to differentiate from other diseases. World Health Organization welcomes EU resolution calling for evaluation of global response to the coronavirus pandemic. Over 4.8 million people around the world have tested positive for COVID-19 since the outbreak of the pandemic in December 2019. Close to 20,000 deaths have been recorded, while over 1.8 million people have successfully recovered from the viral disease. So far, research has shown that the infectious disease is spread primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes or sings. Research has also shown that about 80% of the people infected with COVID-19 will experience mild to moderate respiratory illness and recover without requiring special treatment, but the remaining percentage could succumb to the disease. Perhaps the mild and malaria-like symptoms experienced by some of those who have recovered from the disease, the non-specific treatment and the trial use of some medication for the treatment of malaria is now casting some confusion in the minds of people. This evening on the show, we'll be looking at the main difference between COVID-19 and other diseases. The number of confirmed COVID-19 cases in Nigeria exceeded 6,000 with the announcement of 216 new cases yesterday by the Nigeria Center for Disease Control (NCDC). The new infections were recorded in 14 states and the Federal Capital Territory. Out of the total 6,175 cases, 1,644 patients have been discharged and 191 people have died. Lagos has 74 of the new cases, Katsina as well, Oyo, Kano, Edo, Zamfara, Ogun, Gombe, Borno states having 8 each, 7 each in Bauchi, Kwara, 4 in the FCT, 3 each in Kaduna, Enugu, and 2 in River State. A breakdown of the figures, as you can see by region, has Lagos at number 1 in the southwest and the country, followed by Kano. Also, the FCT is third highest in the tally with 422. Borno tops in the northeast with 223 cases. Edo leads in the south-south, followed by Enugu in the southeast. At the Presidential Task Force briefing today, the Secretary to the Government of the Federation, Mr. Boss Mustafa, explained that the extension of the ease of lockdown by 2 weeks is not punitive. The Secretary to the Government of the Federation used the opportunity to charge Nigerians to adapt to the changes COVID-19 has brought and do all they can to limit the spread.
Share your pains and also share your concerns. However, as I said yesterday, our future remains in our hands, and compliance is one of the keys to opening that future. As we go into the first week of the extension of Phase 1 under the eased lockdown regime, we appeal once more to everyone to diligently comply with measures put in place. Of particular importance is the need to obey the curfew, obey the ban on interstate travels, observe physical distancing, continue to avoid large gatherings, and obey personal and respiratory hygiene, and align with the policy on use of face masks or coverings. For those who are struggling with the disease, help is available. Do not go underground. It is important to talk about it and to seek help. Every effort spares humanity the agony of the spread of the virus.
For the Director General of the Nigeria Center for Disease Control, the biggest change the pandemic has brought is the country's attitude towards preventive control. Dr. Kwazu confirmed that personal protective equipment will be distributed across the country.
And the place of PPEs has suddenly become elevated because of the level of society that feels at risk for this new infectious disease. But the rational use of PPEs is really something that needs to become a sustained change in our sector. In most procurement plans of our federal institutions, state institutions, even in private sector hospitals, you would rarely find a procurement of PPEs in any of them. This has to change. During this outbreak, yes, the federal government, state governments, the private sector, donor agencies, the UN, everybody is procuring PPEs. We're distributing PPEs across the country. We have a whole big logistics plan over the next 4 months of PPE procurement and distribution. But we all know that this is not sustainable. We all know it is not sustainable. We have to go back and normalize the procurement of PPEs into the routine procurement plans of our institutions so that we plan for this and we use them routinely. But this will not happen if Nigerians don't demand that it happens.
As Nigeria continues another 2 weeks of partial lockdown as a result of the coronavirus, the National Orientation Agency is blaming security agencies for failing to strictly enforce the restriction order on interstate movements despite the number of confirmed cases and deaths across the country. Speaking in Abuja while presenting a report on the observation of the agency and the fight against COVID-19, the Director General of the NOA, Dr. Garba Abari, explains that some security personnel are compromising the ban on interstate travels and the curfew by collecting gratification and allowing free passage of unauthorized persons. Dr. Abari says the agency is collaborating with the Independent Corrupt Practices Commission, ICPC, to set up a surveillance team to ensure that those who indulge in acts capable of sabotaging the fight against COVID-19 are apprehended and brought to book.
The lockdown was initially effective, but subsequently it waned in efficacy, especially in cities where enforcement measures were concentrated. However, in the suburban and the rural areas, businesses continued almost as usual, despite the lockdown. Many religious centers, or most religious centers, complied with the ban on gatherings, especially in the cities. But in the suburban and the rural areas, religious gatherings still continues as usual. Security operatives in some states are compromising the ban on interstate movement by accepting inducement and in exchange granting travelers easy passage.
And Lagos State Ministry of Information and Strategy has embarked on advocacy to different locations across the metropolis to sensitize citizens, residents on the importance of face mask use as part of efforts to curbing the community transmission of COVID-19 in the state. The campaign exercise tagged Mask Up Lagos was led by the Assistant Director, Ministry of Information, Mr. Bode Lawal. He said the advocacy is geared towards encouraging all residents of the state on the need to support the efforts of the state government to curb the spread of COVID-19. The irregular use of face masks, especially in public, combined with frequent hand washing, social physical distancing, as well as embracing other personal hygiene safety tips are the most effective ways of containing community spread of the pandemic. Some of the locations covered during the advocacy campaign included Maryland, Palm Grove, Onikpan, Julegwa, Funshaw Williams Avenue, Stadium area, Body Thomas, Ipori, Costain, Orile, Apapa, among others. Well, joining us for more about knowing COVID-19 in the studio is Dr. Tiuasi Rahim. He's a medical scientist, research scientist at the Nigeria Institute of Medical Research, NIMA, Yaba, Lagos. Thank you for joining us.
Thank you very much for having me.
All right. So we're having 191 deaths toll as a result of COVID-19. Would you say that Nigerians are properly educated on what coronavirus is?
Yes, thank you very much for this enlightenment program, which is very, very important. Looking at the case fatality rate, that's the death rate among the affected people, we can say that some segment of the population, some segment of Nigerians are not properly educated, while some segments are educated, especially those in the urban areas are somehow educated. But those in the rural area are still not properly educated. And that is why it is highly necessary for us now to move our serious advocacy to the rural area.
You say somehow, urban, rural. I'm a bit worried because online today we had a hashtag that was trending, end COVID-19 scam. Some people still feel COVID-19 is a scam.
Well, that is why I said that much of the work has to be done in the rural area. In the urban community, most people are aware and they have seen people and they have read a lot about COVID-19. Whereas in the rural area, there is much to be desired. There is need for more of the advocacy to be moved to the rural area.
So let me ask you some of the questions which I gathered on COVID-19 as to what people think. One is that, what is the proof that coronavirus exists?
Well, you know, some people will still want to doubt, even when you say there is heaven, people will still doubt it. You don't have to die until you see that, you know that there is heaven. Definitely, there are many proofs. We have seen information data from people that have been infected, and they have also confessed that, yes, after the intervention, they felt better. We have seen governors, we have seen even the highly placed public officer in this country. We have seen so many people. We have seen colleagues that have been infected as a result of a performance of their duty as health professionals.
So what has COVID-19 got to do with malaria?
COVID-19 is obviously quite different from malaria. There are so many reasons. They are quite different. They are not the same. In terms of the causative agent, they are not the same. The malaria is caused by a Plasmodium species, which is a blood parasite, whereas COVID-19 is caused by a virus called SARS-CoV-2 virus. It's a novel virus. In terms of geographical spread, you'll see that usually malaria was said to be common in the tropics and subtropical areas of the world. Whereas you see even COVID-19 more pronounced in the tropical areas of the world, in Europe, in America, in Australia, and so many other places where you ordinarily don't see malaria. So it's not the same.
So if you're saying they're not the same, why are we having the same, almost the same treatment, hydroxychloroquine?
Well, it is, when you look at the reason for why chloroquine, whether hydroxychloroquine or the ordinary chloroquine was suggested to be effective, because I said suggested because there are ongoing clinical trials in Nigeria and outside Nigeria to really confirm the safety and the efficacy of chloroquine, whether hydroxychloroquine or the other ordinary chloroquine. So, but if you look at mode of action that was suggested, there is something we call angiotensin converting enzyme 2 in SARS-CoV-2. That enzyme is responsible for why the virus is able to attach to the cell membrane, either the mucous membrane or the cell membrane, before it can now enter the cell and continue to infect some other cells. So the chloroquine is suggested or is said to be blocking that enzyme. And if that enzyme is blocked, that angiotensin converting enzyme 2, if it is blocked, then the virus will not be able to enter the cell, and as a result, it will not be able to progressively infect other cells. That is the theory behind the use of chloroquine. But definitely it's not the same, malaria is not the same as COVID-19.
All right. Hopefully we'll have you in the future to dispel some of the myths and perhaps rumors we're hearing about COVID-19. Thank you so much, Dr. Tiuasi Rahim, medical scientist with NIMA, Yaba, Lagos, for joining us.
Thank you very much for having me.
So to come, we have more on global efforts to curbing COVID-19. Join us again. Let's now update you on the latest efforts across the country to stopping the spread of COVID-19. We begin with the management of the Federal Medical Center, Dear Abba, in Abeokuta, the Ogun State capital. They confirmed that they recorded 2 new cases of COVID-19. The hospital's spokesman says the 2 new cases are from the Lagos axis, adult males who presented at the center's Accident and Emergency Unit Saturday, May the 16th. And the House of Representatives, they're asking the Minister of Health for the full details of the activities and whereabouts of the Chinese doctors. This is the resolution of the House, which stemmed from a motion of urgent public importance raised by Representative Dachung Bagos. The lawmakers say they are not satisfied with the statement of the Health Minister that the Chinese doctors are not guests of the federal government, but that of a Chinese firm in Abuja. And 19 patients in Nasarawa State have been discharged after testing negative for the virus twice, Governor Abdullahi Sule disclosed during the state COVID-19 stakeholders review meeting at the Government House, Lafia. He also announced that 1 new case, bringing the total number of confirmed cases in the state to 33 and 13 active cases, including children of 4 and 13 years of age. Still, with regards to the global efforts to curbing the pandemic, joining us now is Dr. Olumide Oyeron. He's the consultant gynecologist, subspecialist in gynecological oncology, robotic and laparoscopy surgeon with the Royal Wolverhampton University Hospital, the NHS Trust. Thank you for joining us on the program. First, please give us, perhaps, let me start with what you've observed with regards to the handling of the pandemic since the guidelines from government in the UK on easing the restrictions.
Well, thanks for having me. Well, the first word is confusing. The reason why I said confusing is that we felt that the guidelines about the easing weren't clearly expressed. Furthermore, the home countries, so I'm talking of Scotland, Northern Ireland and Wales, seems to have deviated slightly from the guidelines set up by the government. So it only seems to be in the in England. So things like, oh, you can go back to work, but don't use public transport. But then a lot of people who don't have cars have to go back to work. And the issue is what sort of measures have been put in place for those going back to work to ensure social distancing. It also, I think that amongst many others. But I think overall, what we should realize is this is quite unprecedented. And, we have to give kudos to efforts by governments who have not experienced this before. So I'd say we're getting there. Just that things need clarity, that's all.
Talking about that, we heard the Transport Minister said there's more palliatives now, encouraging people to walk more and cycle more in the UK. But let's ask you, with regards to doctors, obstetricians, how would you say they are tackling COVID-19 in an emergency setting?
Well, that's a very tricky one, because recent studies have shown that the attendance to the emergency has dropped by up to 70%. Now, you might think this is because of the COVID, but there are concerns that people who are actually sick don't come in. What we've done is we've encouraged that, we've set up virtual clinics. So when I mean virtual clinics, telephone consultations where people call in, and if they are assessed over the phone, and if they need to come in, we have special areas that are designated for emergencies. So emergency theaters, emergency wards, emergency staff, so that they do not mix with already inpatients It is quite tricky because not only do you have to move stuff around, you also have to bring up more resources in terms of creating all these areas. But they've been quite effective. The emergencies are going on, and so I think we're handling that quite well.
Just before we let you go, tell us what indeed pregnant women, how they can fortify themselves, especially from catching the virus this period.
Okay. Now, as we know, pregnancy is a state of reduced immunity. However, the good news is that there is no evidence that pregnant women are at risk of the COVID-19 infection or its consequences than the normal population. We do encourage pregnant women to be aware of the signs and symptoms, of the common signs and symptoms of fever, cough, sore throats, and what have you. We encourage the usual, stick to government guidelines of hand washing, regular hand washing, avoid people who have the symptoms, avoid large gatherings, I know we say avoid family and friends. So far in the UK, there are still restrictions on restaurants and bars and salons for now. And I think there's also the encouragement of using face masks in public. Now, you might say that there is no evidence that face mask prevents you from getting it. True. But if you are in an environment where everyone's got some form of protection, then it reduces the viral load. So those are part of the advice that we give pregnant women.
All right, we'd like to appreciate your time, Dr. Olumide Oyeron, consultant gynecologist, subspecialist in gynecological oncology. Thank you for joining us and continue to keep safe. Now, the World Health Assembly has agreed to the independent investigation into the response of the global coronavirus pandemic. Mr. Palau is calling for Taiwan to join WHO COVID-19 Forum, plus Britain is defending its handling of the outbreak in care homes.
To the head of the World Health Organization, WHO, threatening to pull U.S. funding permanently over COVID-19. The letter outlines a 30-day deadline for the body to commit to substantive improvement or risk losing millions and U.S. membership altogether. Addressed to WHO Chief Tedros Ghebreyesus, it criticizes stages of the body's response since December.
Key role in our society.
Meanwhile, the president made a surprise announcement saying he is taking hydroxychloroquine to ward off coronavirus, despite public health officials warning it may be unsafe.
No, I think for whatever it's worth, I take it. I would have told you that 3-4 days ago, but we never had a chance because you never asked me the question.
Did the White House doctor recommend that you take that? Is that why you're taking it?
Yeah, White House doctor. I didn't recommend. No, I asked him, what do you think? He said, well, if you'd like it. I said, yeah, I'd like it. I'd like to take it. A lot of people are taking it. A lot of frontline workers are taking hydroxychloroquine. A lot of I don't take it because, hey, people said, oh, maybe he owns the company. No, I don't own the company. You know what? I want the people of this nation to feel good. I don't want them being sick. And there's a very good chance that this has an impact, especially early on.
Brazil's hospitals are nearing capacity as the Latin American nation becomes ground zero as its cases surpass those of Italy and Spain. On Saturday, May the 16th, Brazil's health ministry registered 14,919 new confirmed cases in the prior 24 hours. With some 246,000 cases now reported as of Monday, it is now on track to surpass the United Kingdom.
According to the Nigeria Center for Disease Control, taking ownership and collective responsibility is important as we fight the virus. You can find the latest guide on their website, and indeed, the center continues to work closely with states. You can find the latest national strategies to scaling up access to the coronavirus disease testing in the country. Also, the World Health Organization has a lot of rolling updates, and their strategy on their website guides the public health response at both national and subnational levels, including practical guidance for strategic action that is tailored to local context. Also, our website, channelstv.com, has more updates. You can find the latest on the pandemic in Nigeria, across the world, plus other stories. Just log on to www.channelstv.com and you find the news at your fingertips. Thank you for watching. Another update is back at 9 p.m. I'm Millicent Nwonka. Thanks for now. Bye for now. Stay safe and stay healthy.